T-cell malignancy represent a group of hematologic malignancy with a high relapse rate and mortality rate. The shared expression of targets between the CAR T cells and the malignant cell has limited the development of CAR T due to the unintended CAR T fratricide. So we have developed a fratricide-resistant anti-CD7 CAR T modified by the CD7 ablation through the CRISPR-Cas9 gene editing. So with those technique approaches, we're able to apply that to our phase 1 clinical trial. So in the recent EHA, and we are happy we have the opportunity to present our results, oral presentation, give our results for those KO7, we call the KO7 CAR for treating our T-cell hematologic malignancy patient, which including T-cell acute lymphoblastic lymphoma and lymphoblastic lymphoma patient, and even including a few patients for mixed phenotype acute leukemia. So the KO7 CAR is the second generation CAR, is a murine-based CAR structure with 4-1BB as a co-stimulator. So we actually recruit 15 patients, which including 10 patients with a TALL, 3 patients with LBL, and 2 patients with mixed phenotype acute leukemia patient. The manufacturer was 100% successful. The CAR T cell can either derive from patients' own blood or from their transplant donor. As a matter of fact, for our 15 patients, 4 of them at least was relapsed from previous allotransplantation. So actually it's heavily pre-treated group. With our CAR T therapy, on day 28, we did a complete evaluation. We find out 100%, 15 out of 15 patients able to achieve deep, minimal residual disease, negative complete remission in their bone marrow and the blood. And the 9 patients with extramedullary disease involvement, six of them able to achieve complete remission. The other 2 are able to achieve partial remission. So results are very encouraging. Subsequently, 12 out of those 15 patients also had allogeneic transplantation with a median follow-up time about 253 days, even up to 388 days. 11 out of those 12 patients still remain in complete remission. Only 1 patient actually find to have a relapse on day 217 after transplant and find to have a relapse. And at that time, the CD7 expression was lost. And so the other 2 CR patients without allotransplantation died early in the course, one from infection, the other is from graft-versus-host disease. However, both those 2 patients are heavily pretreated and relapse very early from previous bone marrow transplantation. As a matter of fact, 1 patient will relapse less than 3 months from the allotransplantation. The other was 4.5 months from allotransplantation before had our CAR T treatment, so heavily pretreated. But nevertheless, we are really encouraged about those results. And the side effects profile are also very manageable. And majority of patients only have a grade 1 and a 2, we call the CRS. And 3 out of 15 patients develop some degree of neurotoxicity, but no patient died from the this clinical trial. So with those results, we think with those anti-CD7 CAR T certainly provide a hope for those patients with T-cell malignancy, and we are going to do more clinical trial in the future, and those patients will also observe that longer.